Welcome to the Policy and Scrutiny Committee for Health and Social Care. So before we get started, I'll just read out the fire procedure. In case of emergency, there are no planned fire drills during this meeting, but if you hear the fire alarm sound, please treat it as a real emergency and evacuate the building via the nearest safe escape route. Apologies. So we have apologies from Councillor Lever and Councillor Drew, but nothing from Councillor Spink. So we'll wait to see if he comes later on. Next on the agenda are the minutes. Does anyone have any comments or changes? Nope. So I move the minutes. Anyone propose that? Second. And it passes. Thank you.
Sorry to interrupt, Chair. Yeah. Can I just check that you got my email in respect of the minutes?
Yes.
Thank you. Thank you.
Any declarations of interest? Nope. Okay. Public question time. We had a public question come in from Mr. Knowles, but there is a agenda point on that topic. Is Mr. Knowles attending today?
As far as we know that he is.
Okay. So we might have to go on without him unless he turns up. And we haven't received any other questions, and there's no one in the gallery. Progress update. We have one outstanding action. The ICB were asked to provide the committee with a comprehensive plan within 8 weeks that would realistically improve NHS dental services on the island. And we are notified that an update will be provided to the committee once guidance has been determined by the new government on how dentistry will be approached moving forward. So we can presume that 8 weeks won't be fulfilled. Yes, Rodney?
Wasn't commenting. Ridiculous. Thank you, Chairman.
Rodney, do we have any other comments on the progress update? Yeah. Thank you.
Thank you. Yes. So I've had a meeting with the Director of Primary Care, and they are doing some work. So they have got an action plan, but I really think it would be helpful if we had sight of that action plan, particularly given the fact that we're likely to lose another NHS dentist pretty shortly, which will leave us with very few NHS dentists on the island. So again, the problem's getting worse. And we're aware that more people are seeing a dentist now. Well, more appointments were given in the last 12 months, but less people have seen a dentist because the people that are going to see a dentist they need a good amount of treatment. So again, the actual number of people seeing a dentist is reducing. So yeah, I do feel an action plan would be helpful for committee members to be able to see whether, they're doing enough for people on the island.
Thank you, Jo. Debbie?
If it's helpful, Chair, I've got a meeting with the MP Jo Robertson this Friday, specifically to talk about the dentistry issue. I think it's fair to say that the lead for the ICB has actually been on leave and has only just come back. She will be at that meeting together with the relevant people from the ICB that are working on the plan. So I'm more than happy. What I'm planning to do is to actually do a briefing note with that meeting, and I'm more than happy to share it by way of an update.
If you could, that would be great. And if you could mention to them about sharing a draft or something with us in the future, that would be very helpful. Thank you. Councillor Lilly.
Thank you, Chair, for allowing me to raise speak on this issue. I actually had a briefing with on UMP Joe Robinson on the East about dentistry, and particularly he's in liaison with Edward Day from Denby House, which is the only NHS, the only sole NHS who actually presented to this committee. The sadness is that practice has lost 3 dentists. That one through illness, that the other 2 actually because of travel, because they come over, have been coming over for a long time from the mainland, particularly on the hovercraft. And I know I've raised this issue with your briefing with hover travel, but because of the unreliability of the hover travel and the travel, they had decided to give notice in and actually work on the mainland. So our 50% of the NHS patient going through Denby House have now got a situation where they've got to recruit a new dentist. I think they've got one, but there's a real difficulty. And I did set up meetings with Hover Travel and Denby House to try and get over or find this over this particular problem of reliability, right, and priority of that. But I just wanted you to highlight that the dentist practice we saw is now half the size when it actually came to this meeting.
Thank you, Councillor Lee. That's thank you. Simon?
Can I make a suggestion? So there's 2 issues in there. One is we don't know what the new government policy will be on dentistry, and that won't be soon. But there's the issue that actually need an answer, and I suggest we ask the ICB for a written response to how they're managing the current situation whilst awaiting the new guidance, because it could be some time, and that might save them. Get a written response from them.
Yeah, I'm happy to do that. I think we'd asked them for something before and we were sort of still waiting for something. So maybe something less than a plan would mean we'll get at least a response quicker. Yes, Councillor Nicholson.
Chairman, I think this is too important an item to just let slide. And I know, we've got excuses, etc. But I propose that the committee note that we are still waiting for a response from the ICB to see a plan from the ICB, but we also express dismay that the situation, far from even being static, is getting worse, and we'd like an explanation with that response, please. That's a proposal. Rodders, can I second it?
All in favour? Passes. Are there any other comments on that item or the rest of the progress update? Okay, we'll move on to the agenda point on the 5-litre sharps bins. We had invited Mr. Knowles here today to say his question, but also to summarise a little bit about what's happened so far. So I will do that on his behalf. So Mr. Knowles has come to the committee a few times to raise this issue. At the meeting on the committee on the 5th of June, he raised that the clinical waste collections, they're struggling to have a 5-litre sharp bin collected. It was established that the Isle of Wight Council was the organisation responsible for the disposal of domestic medical sharps. Following further public questions asked to the committee in March 2024 and June 2024, the Council's Sharps disposal website has been updated with contact information regarding 5-litre and 7-litre bins, as well as updating the list of pharmacies involved in the Sharps take-back scheme. We invited the residents to come and speak on today to provide feedback on how this was working and if there was any further questions on it. And Mr. Knowles put the question to the committee. The draft minutes of the 3rd of June 2024 meeting of the Policy and Scrutiny Committee for Health and Social Care note that in relation to the interim arrangement for the collection and disposal of larger sharps bins, It was agreed that the Strategic Director of Community Services would be contacted for a response to these questions and concerns in the next 7 days, and a press release should be issued so members of the public are aware of the guidance. Although a response to the questions was provided, I found no evidence of a press release having been issued. Please advise how and when the press release referred to above was and will be issued. And then I'll pass over to Colin for a response on that.
Thank you, Chair. First of all, apologies I can't be in person at the meeting, but hopefully, thank you for inviting me to the meeting. What I'm going to do is I'm going to pass you over to Natasha Dix, who is the relevant service director for this particular service area. And Natasha's going to talk through the process currently that we go through in terms of collection of sharps bins and the availability of sharps bins for people in the community.
Hello? Is that okay with you, Chair? Colin's proposal?
Sorry, go ahead.
Yeah, I was just confirming that's fine with you, Chair, that I take the colleagues who are at this meeting through the process for sharps bins on the council's website. I'm sure
Yes,
Colin will
please.
refer to the question on the press release in a moment. Okay, thank you for inviting me this evening. I will be brief, but just for those who have not had the opportunity to have a look at the council's website, I'm just going to share my screen. And this is the information that is provided. Hopefully that will appear before you. Yes, I can see that. Okay, so for our residents, coming to the front page of the Isle of Wight Council's website, I'll start at that point so that we can look at the ease. There are two ways you can access the sharps page. The easiest is to simply write sharps in the search filter, which will take you to sharps disposal. This describes the service available, and our colleagues in the web team have ensured that everything that is on our pages within waste is of an accessible language in an accessible format, so it can be used by people using screen readers as well as those who read with their eyes. So initially, this sets out that the Sharps Take Back scheme is available on the island. The reason we use a Sharps Take Back scheme here rather than doorstep collections very much amounts to the cost, as there is no disposal facility licensed to treat sharps on the island. So all sharps collected here will then transfer onward to Bournemouth, St Mary's, where they have a clinical waste incinerator. Okay, so the Sharps Takes Back scheme has been in place before our current waste contract with Talia, and was passed into this contract with the list of pharmacies that is available on there for the collection of sharps at pharmacies. In 2015, the sharps that were requested to go into this contract were 1 and 2 litre boxes, as well as cytotoxic sharps. Obviously, technology has changed over time, which has raised this growing need to collect different size boxes. This has been updated to inform residents that if they have a 5 or 7 litre sharps box that they are unable to dispose of at any of the participating pharmacies, they can contact the waste team. There is a telephone number there, as well as an email address. And when they contact us, they will be asked if it is a one-off collection, in which case we will simply collect the box, or if they need an empty box also delivered to them at that point for a further collection in the future, in which case they will be offered that larger empty box. And then there's further information there related to other sharps incidents. So hopefully that is quite simple and explains very easily for our residents what they need to do going into the future.
Thanks,
Any
Tash.
further questions?
So any questions for Natasha or myself on those particular aspects?
Joanna.
Thank you. I did notice that the list of pharmacies is out of date. Some of those pharmacies on your list have closed. I did make the council aware of this some months ago, and I was assured that it would be updated, but yeah, it would be helpful if that was updated, because some of those pharmacies are not there now.
It's quite a little interesting one now. somebody did update the website, but they updated it with every single pharmacy that existed on the island without checking whether or not we collected from them. For the moment, this has been reverted back to the ones that are within the contract with Talia. And we are looking at those ones which have been closed or have changed names, and then we'll make sure this is updated accordingly.
Thank you. It would be helpful if that was, if you do that as quickly as possible, because it would be no good directing people to pharmacies that aren't there anymore.
Absolutely, but and equally ones that don't collect sharps in. So we need to make sure it's absolutely 100% accurate before it goes online.
Any other questions? Natasha, did you want to speak on the press release?
I believe Colin. That's for Colin.
I think that's basically a decision that you might want to recommend as a committee. If you think a press release is appropriate for us to outline the service, then that's something that you would want to recommend as a committee.
So I think part of Mr. Noel's concern was about the communication of the information to patients, particularly between this meeting and the previous meeting. He did email with an instance where he got the wrong information from a health professional, or I think it was either, or perhaps it was a receptionist at the GP. So I think his keenness for a press release was to make sure that more people know about this interim. I'm taking it's an interim arrangement. This is something that we discussed at last meeting, but I can certainly put it to a vote, move it to suggest that we put a press release out. Do I have a seconder for that?
Yeah.
All in favour? Okay, thank you. We'll take that as an action.
Okay, we'll take that away. We'll work with our health partners to look for a press release that looks at the whole flow, the customer journey of this arrangement, because obviously the 5 and 7 litre bins are actually provided for by our health providers. So we will look at that throughout the journey so that people are aware from throughout of the process.
Thank you, Colin. And one of the questions I had was, is this an interim arrangement, or is this going to be a long-term solution?
I think currently it's an interim arrangement. We do need to have a better understanding of what the likely future demand might be, and that might change the arrangement given the additional costs that might be incurred, or the additional arrangements given that we have got a growth in numbers going forward. But what we do need to understand, and we need to work with our health partners again, is the likely numbers coming through the system, so we can then plan, if we need to, for an additional service or an enhanced service on top of what we already provide. So it's not strictly an interim arrangement, but we do need to get more information from our health partners as to what the likely demand might be.
Thank you, Colin. Councillor Nicholson?
Chairman, I think Scrutiny has done its job at long last with this issue, but might I suggest, Colin, that this is taken, and Natasha, that you discuss this at the ICB, because they'll have the full information, including an up-to-date list of pharmacy. And of course, when you're placing an advert, the advert needs to be both helpful and accurate. So I think the correct place to take this now is the ICB to approve an advert, a joint advert, maybe.
Are you happy to say? Sorry, carry on,
say
Colin.
that way, yeah, sorry, yeah.
I was just going to ask if you're happy to take that up as an action, Colin.
Yeah.
Thank you.
We can coordinate a press release based on the information we get from our partners, as well as the information that we've already got with us. Yes.
Thank you. Are there any other questions or comments on that agenda point? Thank you. We'll move on. So the next agenda point, we have a home care update. Can I ask who is presenting this?
Debbie,
Is it?
Debbie, you presenting?
I am.
Would you like me to support with the answer?
I'm happy to give an introduction to it. Yes, this paper's come through. It's got my name on it, but it is important to actually point out that it is it's to review how the quality of service is maintained and the feedback that is actually from our prime providers. So so I will introduce the paper. Just bear with me 1 second. So, as you will see, this paper has been brought forward from our 3 prime home support providers who were, as it says, were awarded the contracts. What we've done is, in terms of our home care providers, we have aligned them with the 3 localities, the locality hubs on the area, on the island rather. So there is northeast, south, and west. So, as it says, each of the 3 lead providers, as part of the contract, are required to subcontract a minimum of 30% of the work referred to them to other local providers. We are fortunate that we do have a wide number of home care providers on the island. And this also ensures that we have reach across the island as a whole. So, as I say, so the appendix 1, which is attached to the papers, actually gives the feedback from those prime providers. And I'll now pass over to you.
Thank you very much for introducing it. So we moved to a new model. Yeah, mucked up. We moved to a new model of providing domiciliary care back in 2021. So rather than commissioning with multiple different providers, we moved to the prime provider model, so aligned with localities, as said. There are around about 31 domiciliary providers across the island, though, and it is a requirement that prime providers do subcontract, make sure we still offer choice as our response in the Care Act. One of the things that we have found through that model back in as early as November 2022, there was several hundred outstanding packages of care that we were really struggling to source, and that equated to about 1,400 hours. So people were waiting for care that we really couldn't source. There is no waiting list for care now for domiciliary care, so that has continued. And there is still growth in the domiciliary market. So we are still seeing an upward curve in people taking up domiciliary care, which is a really positive thing, that people are actually getting care in their homes as opposed to having to default into other provisions. Not that other provisions such as residential and nursing aren't important. They absolutely are. We need a whole suite of different options for people. Rather than listen to officers tell you how we do it, we've actually invited some of the prime providers who would, so we've got a couple here from Sarah Pear, sorry, you've just, and we've got Joe also on screen from First City. We were expecting someone from All Care, but they've had to drop out at the very last minute, so I apologise. So I'm going to hand over to you guys to, the brief around this was, how do we ensure we're still getting the voice of the person that's using the services? And I thought that's why it would be better to have you come along and explain how you do that than somebody saying that we think you do that.
Thank you very much for having us, everybody. It's very nice to be here. So I'm Sarah Hedges. I'm one of the regional operations managers for Sarah Care. We have lots of different entities that operate within Sarah Care, and Care Quality Services, which is Julie's branch on the Isle of Wight, is one of them. So I'll let Julie talk a little bit about how we monitor the subcontractors a little bit later on. We have got a quick presentation. Please stop me if I'm taking too long, because I can talk about our business for a long time. So bear with me. So I just included this slide. So this is our mission: to empower people to live longer, healthier lives in their own homes. And our vision is to be the global leader in revolutionising care for the better for the users and society. And our values are commit, connect and create. And we embed that in everything that we do at Sarah Care. And that's filtered through to all of our branches, no matter what entity they are. So we wanted to talk a little bit about client and carer feedback, because they are the two groups of people that are at the heart of everything that we do. So our customer feedback. So we have an annual customer survey that is get sent out to everybody via email and via post, so that we can gather as much information from that as possible. We have 6 monthly quarterly reviews that we hold with all of our service users. 3 monthly telephone review. And we also have a suite of reports in a system that we call Looker. And we use the information from those reports to collate the feedback that we have in, and we provide all of our branches with evidence in percentages of how happy their customers are with the service that's being provided. And they are measured on their successes by the quality of care that's delivered. So we regularly communicate with our customers. Their feedback is vital and is a big part of measuring the quality of care that's provided. And so from commencing a new care package, we have regular reviews with the customers. So from a 2-week review, when we first start to touch base to make sure that everything that we've put in place is the right thing for the customer. We follow that up with a 3-month voice of the customer review, which tends to be over the telephone. And that can either be with the service user or one of their next of kins, depending on capacity. Then we have a 6-monthly face-to-face quality review. And then we go back to, at 9 months, having another voice of the customer. And then they have an annual care review. So our carer feedback, we have an annual carer survey that goes out. That's sent out by post and by email. And we also send out a monthly carer survey on our Sarah Care app. So Sarah Care has its own technology. We have an app that the carers have visibility of, all of their rotas, EMARs, and policies and procedures. All the customer care plans can all be accessed from that app. We have 3 monthly team meetings. And we also have focus meetings with the carers for specific customers, so that we can review packages and share best practice with small groups of people. We also have a suite of focus supervisions that we hold with the carers based on their qualities and the things that they do well and the things that they do not so well, so that we can share that across the board. All of our carers obviously have a medication competency as well. They have a 6 monthly supervision and an annual appraisal, and we monitor their punctuality, duration and the continuity of carer through our KPIs with all the branches. So we provide feedback following all those different kinds of meetings with the customers and carers through monthly newsletters. We have a central one that Sarah Care send out to everybody, but also the branches have dedicated newsletters as well. We operate a "you said we did," so that people know that we're responding to anything that they bring to our attention. We do have to manage people's expectations sometimes. Although people have the right to complain and bring things to our attention, we also go back to them and explain the reasoning why we have to do things a certain way. We also send out update letters for any changes within the business. And we hold open days in branch. We have an open door policy in all the branches, and we have special events. So we've held pressure sore awareness days where we've played pressure sore bingo with customers and kind of promoted what to look out for. And this week is Hydration Week awareness. So we're promoting that in all of our branches at the moment as well. So central communications go out, but the branches are very much encouraged to get people into the branches, get the carers in, and promote those things. So quality and compliance, complaints and compliments. So I talked about the suite of looker reports that we have that we can drill down and we monitor with the branches. So we have KPI reports that we pull, but these are a few of the things that we look at. So the carer survey is shared with the branch managers so that they can change things and adapt things to work with the care team. We monitor their checking in and checking out, punctuality. They have league tables that we monitor. We also have EMAR auditing. So every month, the branch manager is responsible for doing an audit of all of the medication within the branch and checking that the alerts are closed down in a timely manner, that any scheduling discrepancies are fixed quickly. Carer retention. We have recently started really focusing on carer retention. They're sort of a fundamental part of the business. So we have a team of people that report through to the branches that tell us if there's anybody that could potentially be a flight risk. And we highlight them to the branches and we work through their surveys and make sure that we put things in place to stop them from leaving if we can. And then we have our quality and compliance overviews that the regional managers work with the regional directors and we feed all of our findings through to the managers and work with the branch teams. The branch managers do a 3-monthly branch audit so that they have a really good oversight for the care that's being provided, not only by them, but by the subcontractors as well. I'll let Julie talk to you a little bit about how we audit with the subcontractors.
So the 30% that was originally mentioned about going out to the subcontractors, obviously we need to maintain that they're providing care to the standard that's required as well. So they also get an audit very similar to, I mean, we have to look at the CQC rating to start off with before they apply to make sure that they've met certain criteria and obviously producing a service of the standard that that's required. So they get audited. So it's similar to a CQC inspection, but not as detailed. So we go in and we would just make sure that all their carers have got the right to work permits and everything else is all in place first. And then obviously that their training's up to date, because a lot of the feedback, it's all based around that training. If the carers aren't trained and don't have that experience and knowledge to pull on, then that's where the service starts to fall down. So we go in and we audit all of the subcontractors as well. Also get their feedbacks. We contact the service users that have been allocated to them, and we do the same as what we do with our service users. So everybody's treated the same, whether they're subcontracted out to another care agency or they remain directly under our umbrella, because obviously it's a quality of care across the board regardless. So that's how we do that one.
So there's a long list of things that we do for complaints and concerns, and we'll be here all night, so I won't read them all out to you. But they were in the document that was shared with everybody before the meeting. So we're very proud of the service that we provide. We celebrate our successes. We acknowledge achievements with the carers, give them recognition for the good work that they do. We have Sarah Stars that we award to anybody within the business who does a good job, who goes above and beyond. And the branches all have a carer of the month that they nominate. All of those go into a big prize draw, and they can win up to sort of £500 depending on how that works sort of within the business. We record all of our complaints and compliments on our internal reporting system, Jarvis. That's overseen by the wider business. So we have a health and safety department that oversees part of it and a quality department that oversees the other part. We look for trends and things that are happening and we try to reduce the risk to our service users. We always respond in a timely manner and we embrace any changes that are required. It's just some pictures there of our carers receiving their awards. On to safeguarding. So these are the responsibilities that we roll out to all of the branches and the branch managers as their responsibilities to safeguarding, and very much sort of geared around being transparent, collecting information, making sure that everybody is treated fairly, and working with all the healthcare professionals to make sure that we're maintaining people's safety as much as possible. And then so that these are the 4 things that we also encourage people. So these slides have been taken from a management training day that we held recently, and that gets rolled out across the board. So we have 100 branches, and the quality team go around the country and deliver that training to everybody so that everybody has the same information. And then we've got really sort of detailed processes that the branches have to follow. And they all sort of gear towards the transparency, learning from what's happened, and everybody sort of pulling together. So we all know that things happen within the community when we're working with people, but we're very much based on sort of supporting our branches, our branch managers, and making sure that they feel supported by the wider business to make things safer and make sure that we have good outcomes from any issues that have arisen. This just tells you a little bit more about our Jarvis system. So this is our internal reporting tool. So we put any safeguarded concerns, they have to be recorded in a timely manner.
Is Jarvis an acronym?
Yes.
What does it mean?
See, we hadn't prepped for that.
Something bizarre like just another reporting system, but I don't know is the answer. But it's something that doesn't refer to safeguarding. So obviously to ensure that all Seracare policies are seen through, and then the responsibility of the people that are using the systems. So as I said earlier, the Jarvis is overseen by our quality team and our health and safety officers, who feed back to the branches. So it's a very open system. So they input all the information that they collect from any issues that arise. And then whether it's a health and safety or a quality issue, they then feed back and ask for more information to upload documents. And they very much support the branches to make sure that everything's safe and that we've collated everything together in one place. Has anybody got any questions?
Just before we move on to questions for you, sorry, I was just going to say thank you ever so much for that, because you were not asked to provide a presentation and you jumped straight in with one, so that's really helpful. I just wanted to ask Joe Barrowbank if there was anything from First City that you wanted to add. I know you, in the write-up that was provided as part of the appendices, you do something very similar, but I didn't know if there was anything you wanted to add.
No, thank you. I'm glad you said that about the presentation, Peter, because I thought I'd missed something, because that was very impressive and I haven't got a presentation, so I'm glad you said that. But no, thank you. No, I mean, at the risk of not wanting to repeat what's already been said by Seracare, you know, what we do is very similar, really, around customer and carer feedback, complaints and compliments and safeguarding. And our our registered manager, Alicia, did provide that in the reports. I know everyone's got in front of them in terms of the summary. But I think Seracare have obviously given a very good account there of what they do. And like I said, you know, it's all very similar in terms of staff development, in terms of how we learn from complaints, how we learn from compliments, how we collect feedback for ongoing improvement, whether that's feedback from customers, families, carers. You know, it all go. We at First City, we consider ourselves an organisation that's always developing, whether in any of the areas we work in, whether it's in Swindon or the Isle of Wight. And that feedback obviously plays a massive part in terms of how we can keep learning, because, you know, as everyone that's ever had anything to do with social care knows, and home care, it's an area of work that's constantly developing. CQC requirements or Care Quality Commission requirements change all the time. Statutory requirements change, so nothing ever stands still for very long. So, you know, if you do stand still, you can lose touch very quickly. So it's all about the developing. I suppose the only thing I would say was, and Seracare did touch on this, as you said at the start, Peter, we have a requirement to subcontract out a minimum of 30%, which I think is something we fully understand in terms of the development and facilitation of care on the island. You know, and we do work with our 10 subcontractors quite closely with the sort of the common goal of making sure that care on the island can thrive. It's not our intention to hoover up all the work, and you know, and we want to work with our subcontractors to make sure that they can be sustainable as well, because again, you know, we all know how delicately balanced the care market can be. We've seen good things, we've seen bad things, we've seen capacity not being enough to meet demand. And you think of how things were over COVID, it became a very, very difficult market to manage. So it's in all of our interests across the island to make sure that the care market thrives as much as possible. So how we work with our subcontractors is key to make sure they can be sustainable too, because they provide fantastic services to a number of people that we subcontract to them. So we have a really clear process of quality assurance amongst our subcontractors. We do at least annual contract audits, which are pretty comprehensive. I think there's about 64 or so questions. They loosely reflect the CQC, not CQC inspections, because we don't want to repeat what CQC do, but the CQC key lines of inquiry, just to make sure that all of our subcontractors, because we hold the contract for our area with the council, so we are ultimately responsible for the people we provide a service to, or we subcontract out to other partner organisations. So we want to make sure that the people providing the support to those vulnerable people have everything in place we need them to do, and they are offering the best service they can. So yeah, without wanting to go on and repeat things that's already been said, it's really important that we are always developing, we're always providing as good a service as we can, and that we're making sure that people who are having services provided on our behalf are also getting the best service they can. Is that all right, Peter?
That's fantastic. Thank you very much.
No problem. Thank you.
Thank you. Thank you very much to all of you for coming and giving a presentation and giving us an insight into what you do. I'll open up to questions. So does any of the committee have any questions? Rodney, you had one, I believe.
Thank you, Sharon. Yeah, I'd just like to ask, with the carers, when they're going into homes and places with people, how many clients, people do they have to look after each day? And how long are they allowed? Because each visit might take longer. Does that make sense? Thank you.
On that, okay.
It's all person-centred care planning. So somebody could have half an hour just for once in the morning, just to set them up for the day. Some people that we look after out there need 2 carers 4 times a day for an hour at a time. Some people are end of life. Some would have 24-hour support. So it really does vary on, the carers that they could have 20 to 25 people in a day, or they might just have 2 or 3. So it really does vary on what their requirements are, and I think there's a much broader spectrum now of support that we offer out in the community as well, just to maintain people's independence.
Is it usually the same carers for the people, so they can build up a rapport with them?
We do try whenever possible.
Where we can do, yeah, absolutely.
We do try. But obviously sicknesses, holidays, car breaking down, carers running late because there's a coach broken down in Brading or something, it can get quite a bit of a logistical nightmare sometimes. But we do try and maintain continuity, because that's very important for the service user as well as the carer as well, because they can see any sort of change and any feedback that we need then to update care plans, or to get other agencies or other professionals involved to support that individual.
Joanna.
Thank you. I've got a couple of questions because I'm not quite sure how it works. So do the prime providers just work with their own group of subcontractors? So you don't get subcontractors that could work for you and for another?
No, they subcontractors could in theory work for all 3 prime providers, and we do share information periodically around who's working with who. It's not a case that the subcontractor can only work for one prime provider. If they cover the whole island, they could in theory have subcontracting agreements with First City, Sierra Care and All Care.
Thank you. And I was just going to ask whether the prime providers work together. Is there any joint work? Do you collaborate? Because I guess that would make sense. And last question was about recruitment. So obviously with the issues around workforce on the island, how easy or difficult is it to recruit staff, the staff that you need?
Shall I take that one, Joe?
Yeah, go ahead. Yeah, sure.
It's very challenging, very challenging. Obviously, it sort of brings into the bigger picture the job prospects on the island, demographics, the location of people that are needing care. There's a lot of, sort of driving around. It's not like we're in one big city. And also, all of those 31 care agencies and the prime providers are all fishing out the same pond as well. So it does make it very difficult sometimes, but that's why there's recruitment days. We work with the college. We've got other things that we're, sort of trying to get into place to encourage youngsters into this industry, because COVID did do a lot of damage. Yeah. Not only, well, to existing carers as well. So it is a challenging environment, and you've got to be sort of cut from a certain cloth sometimes to do any that's sort of a particular area that we work in as well. So it's always challenging.
Not jump in and plug the health and care recruitment fair on the 18th of September.
Yeah.
Which was really successful last year. So we're hoping for the same again in Newport. Good footfall. It was a really positive vibe and experience. So just ask you all, if you see it come up on the social media, just keep sharing it, please.
And I can't speak for the subcontractors, but as a prime provider, we sort of have the benefit of being able to offer guaranteed hour contracts and sort of shift payments for certain visits. So I think that does benefit people to know sort of what their incomes are, because we're able to offer that as a service, and that does come from us sort of being able to know that we have a monopoly on the work, although not all, and it enables us to be able to offer sort of fair pay rates for people too.
It's not a monopoly, but it is an absolute contract that the prime providers are our legal route through to domiciliary care. We deliberately put in a 10-year contract with yourselves to make sure that we could stabilise that. COVID was a very difficult time, but as I say, we haven't got people waiting forever for packages of care now. I think it's proved that it was the right way forward. It's certainly given the providers, the prime providers, the stability in a decent length contract, in that you can invest in the Isle of Wight and your workforces. That makes a huge difference.
Hiya, Peter. It's Stephen Trowbridge here, one of Joe's colleagues from First City. I just want to add to that. I think it's really important to acknowledge that there has been some change within policy at central government around employment and benefits. And at the moment, I think employment or recruitment is working in places, but it comes directly down to policies from central government, which is beyond our control and your control. So where we can try to get individuals back into work, get them to work within adult social care, and it's a great job. It's rewarding. No 2 days are different. Sorry, no 2 days are the same. And our customer base, it's phenomenal work with people. So it's really important to try and make sure that central government are helping the island in particular, where it's really, really difficult. Any seaside area, whether it's on the mainland, Devon, Cornwall, Bournemouth, Poole, it's really, really difficult to recruit. And there's lots of seasonal jobs, and that's one of the other problems we have. But this summer's been good. It comes down to the policies around central government and recruitment, and benefits and so forth to help us. And overseas recruitment is really, really important on the island and across the health and social care provision.
The original question, I'm sorry, I don't know who asked it, was also about collaboration. I think workforce is one of the areas where we have collaborated well as three prime providers. And I think Sierra Care may agree, we've done a number of sort of joint initiatives around recruitment, because like I said, we're all working together for the sustainability of care on the island. So effective recruitment across the board is in all of our interests. So we do collaborate well. And one of those methods of collaboration is certainly around better recruitment and how we can encourage people into home care. So we've seen some real benefits there.
I think one big element that we really do need to make sure that we're working towards and rowing together as a team, whether it's local authority, whether it's care providers ourselves, is market management and managing the market appropriately, not allowing rates to be different between different provisions, whether that's community care, nursing homes, or contracts from the ICB or the hospital. It's really important in a small area like the Isle of Wight that we manage the contracts appropriately. If that helps, and that helps us then make sure that we can recruit. We're not, and the competition for staff is equal above across the landscape. It's very easy in an area that there's low unemployment, and there's a lot of competition to lose staff from the sector, and then it causes problems at hospital flow and hospital discharges, and our social workers and everybody else trying to find placements for individuals because we don't have the workers or the staff and resources. It's very difficult.
Thank you very much, Stephen. You kind of touched on a little bit what my question was going to be, which was around retention of staff. I found it quite interesting what you were saying about monitoring flight risk and reading through their surveys. Have you found that to have a positive impact on your on your retention rates? And then a second question to that is, are there themes of what are the main reasons why people end up leaving jobs?
No particular trends, although having a system in place where it's highlighted and somebody is monitoring those sort of surveys and looking and picking out people that could potentially be a flight risk, definitely brings it to the forefront for the branch managers to be able to deal with it much more effectively because somebody's watching it. There are many reasons why people potentially are a flight risk, and we tend to find that there are two sides to every story. But it does help, if somebody's reporting that they don't have enough hours, or they have availability one day but not another, or they could go to another company and get a different rate of pay, for example, we can work as a business to look at those issues and pull together.
I think what's really important is I don't think we see staff moving from lead provider to lead provider. And I don't know the other lead providers on here, but I don't see many staff leaving from my own service to go to other domiciliary care services. We find that staff tend to leave because they're having a run of bad luck with their car. We help people as much as we can. We offer interest-free loans. We help people get back on the road. We help them with mechanics. But when they're having a bad run with their car, they can fall out of love with the job around the transport, because it's not just the caring aspects that we're looking for. We're looking for staff who are very caring, but we need to make sure they're mobile and can get from A to B. So the car's a big worry, and that's a big risk to the sector. And petrol prices, they go up, and those factors can influence what happens going forward around the staff staying. Not just that though, it's very complicated when it comes to dynamics, the seasonal trends. But this year, I don't think I've had much of the seasonal trend issue. I don't know about others. We haven't lost staff because they've gone to other sectors. We've lost staff because they've fallen out of love with the driving role because of the costs of keeping a car. It's really tough. And I think the only other worry we have is accommodation on the island, and trying to make sure that it's effective, cheap, and people can find good homes to live while they're working. It's really difficult, but you're fully aware of those issues.
Thank you very much. It's very interesting. Are there any other questions from the committee? No. Okay. We'll wrap that up. Thank you very much. Thank you so much for coming, and you're welcome to leave if you want to.
Thank you very much.
Thank you, and sorry for my lateness.
Okay, moving on to the next agenda item, we have Adult Social Care Annual Complaints Report. As Laura isn't here, who will be presenting this? Debbie?
Yes, I'm happy to present this. As it says quite clearly on the report, this comes to committee on an annual basis, and I know that Mel has given the focus, some helpful focuses. The report is clearly set out at Appendix 1. It's a statutory requirement, and I can confirm is produced in according to the requirements of the Local Authority Social Services and National Health Service Complaints Regulations 2009. And the recommendation is members are requested to note the report, but I'm happy to take any questions.
Councillor Nicholson.
I think, Chairman, that it's a very thorough report, as you would expect, and it goes into as great a detail as the law permits it to, and I think it's quite reassuring to see the section on what's learning outcomes. So I propose that we note the report, and thank you to Laura and Debbie for producing such a comprehensive report.
Joanna?
Absolutely agree. And one thing that stuck out for me was the average length of time taken to formally investigate and provide a response is 11.46 working days. Whereas further on in the report, it said that a lot of the cases are more complex in addition to that. So that's quite outstanding, given the nature of some of the complaints. You know, less than a fortnight from beginning to end is really impressive.
Thank you, thank you, Chair. If I can just add to that, I think a lot of the sort of working through of that is that we've very much changed the focus on learning outcomes. So those every case that comes forward, the learning outcomes actually go to review the service as a whole, which the work that's been done has, as you've heard, contributed to actually bringing that time down, because the more we actually learn, the more efficient and effective we are at working, even though the cases are more complex.
Okay, thank you. If there are no other comments or questions from the committee, then we'll move to note. Councillor Nicholson already proposed. Do you have a seconder? And all in favour? Okay, we'll move on. Thank you. Okay, for this agenda point, it's the updated arrangement for assessing substantial change in NHS provision, and I'll pass over to Melanie, who will present it.
Thank you, Chair. I'm just going to read out a brief summary because this has gone to Portsmouth and it has gone to Southampton committees for them to approve, and it is due to go to the Hampshire committee tomorrow. One of the roles of the Health and Adult Social Care Select Committee is to respond to the NHS regarding proposals for substantial change in NHS provision. A protocol has been in place for a number of years to assist with assessing whether proposals constitute substantial change. In January 2024, the legislation underpinning health scrutiny by local authorities was updated, and so therefore the protocol has been updated to reflect these changes. The protocol, as I've mentioned, is used by Portsmouth, Southampton and Hampshire, so that there is consistency of approach between NHS commissioners and the local authorities across the area. The updated protocol is attached as the appendix in the papers. It is recommended that this committee agree the updated protocol. Update has been driven by the change to the referral process to the Secretary of State and would not fundamentally impact on the role or work that the Scrutiny Committee do already. The process itself isn't fundamentally changing at all. It is just updating the framework. So I hope then that you will be happy to approve.
Any comments or questions? Councillor Nicholson?
Just to say that I think it's well presented and well researched. I think the test that the NHS use at this level is whether it can be understood by a 12-year-old, and I would suppose that any 12-year-old could understand that. So I think they've done a good job.
So we propose to, is it note or approve? We propose to approve. Do we have a seconder? Yes. And all in favour? Yes. Thank you very much. Yes, yeah.
We're actually changing to a committee system. And I just wondered how this relates to what's going to be put in place next year regarding scrutiny, because there isn't, in the proposals, there hasn't been a specific separate health scrutiny committee. And I just wondered, when we're talking about consistency or continuity, perhaps this committee needs to actually ask about its position, because there's not many meetings before May next year when there'll be complete change. And at the moment, it seems that the scrutiny committee is combined into an adult social care and health committee. So I just feel that there's an anomaly there between actual functions and that, because the other committees in other areas, they have cabinet system, they don't have a committee system. The unitary authorities, I think we might be one of the very few unitary authorities that have gone to a committee system.
You're right, Councillor Lilly. So with the scrutiny function, there'll have to be a kind of separate bit, particularly for our statutory duties on scrutinising health. So there will be two parts of the committee in that sense, is my understanding. And sorry, Mel, if I stood on your toes there.
No, that's absolutely correct. That the service committee will still have statutory responsibility to scrutinise, and so therefore their powers will still remain the same as what this committee have. And so with regards to this framework, that it should remain unchanged in how it conducts its, I guess, our in-house procedure is yet to be determined as to how exactly that will work. And I believe those conversations will take place over the next few months leading up to the change in May.
Thank you. Are you happy with that, Councillor Lee? Yeah. Okay, thank you. Thank you for bringing it up. Okay, so the next item on our agenda is the work plan. As you can see, we've got quite a full work plan going forward. Does any of the committee have any questions or anything you'd like to add?
Yeah, Chairman, I would like to see something on prevention. We got Simon, Director of Public Health, here, and whose main focus is on prevention. And I know that the strain on primary care and further on down the line is massive. And just like to have an update, if possible, from Simon on prevention and how other bodies might be able to assist in that role.
Quite a large topic you fit there, Councillor Nicholson. Yeah. I think there's something about how do we corral our work on preventative ill health. Let's take the primary care bit away. I'm not going to dive into that because that's another question. Public health as a work programme. I'll talk to Councillor Andre and see. We've got a kind of quite a full scheme of work which we could bring forward. But I think let's be careful not to call it prevention. Otherwise, we just get a little bit stuck. If there's something we need to scrutinise, let's scrutinise it. Very happy to have a conversation, as you know, about how the public health budget works and what we're doing.
Councillor Andre.
Thank you. And just to add to that, of course, we always have the annual report of the Director of Public Health, which always does focuses in on one area and does a deep dive. So obviously that always comes to this committee as well, doesn't it?
I do note that we've got a informal on the 6th of January that hasn't got a topic. So perhaps it might be well suited to informal where we can just talk about that as one subject. Are the other committee members happy with that? Councillor Lilly?
I just wanted to raise the particular that certain reports come out of the LGA, which is all the authorities, right? And particularly, it's come out, I think it's literally hot off the press, a report which is about men's health, and particularly stating that there's a silent crisis right across men's health right across the UK. And I think it's important that when you talk about prevention, we talk about interventions. Can there be local interventions which actually can reduce people going into acute? And there are certain clear evidence of certain groups, like men, for instance, within that. But it also could be that there's other data that says about other particular groups. And I do say that this committee raised many moons ago about veterans, and we particularly said about the high number of veterans on the island. Well, actually now we have got a lot of health agencies that are now working with veterans on the island, but some years ago that wasn't the case, and I think this committee really highlighted that. So there are certain gaps, as it were, in the market, and it's actually identifying those gaps. And I think it's important to look at the data, particularly that comes through the Local Government Association, because that actually is very thorough, and they particular are authorities across the UK. Thank you.
Thank you, Councillor Lilly. Are there any other comments or questions on our work plan? Okay.
Debbie.
Sorry, Debbie, I wasn't looking at you.
Sorry, just to highlight, it still mentions Project Fusion, but the name seems to be changing on an almost daily basis. I think the latest is the NHS Hampshire and Isle of Wight Community Foundation Trust, but it's just really a point to note that it might not be Project Fusion moving forward.
Thank you, Councillor Andre.
Just raise on that. Actually, legally at the moment, it's Southern Health, and because all the workers are actually employed by Southern Health. So it's a good question to ask when this merger or coming together actually is happening, because it seems to be moved back and back and back regarding this. And at the moment, it's actually Southern Health who make the decisions.
Thank you. Without going into too much detail about that right now, but I'll let you respond.
Yeah, so what happened was we had a general election when we were expecting an announcement. So we are waiting any day for the Secretary of State to sign off the fact that what is Solent and Southern are going to merge into the new trust, but it's in government's hands. So we will just wait, and that's what they're waiting for. They're working as one organisation.
Thank you, Simon. Okay, yes, Chris.
Can I just raise one thing on the work plan? December, voluntary sector, sustainability. No indications who's actually going to do that work and how it's going to be conducted.
We haven't really had that conversation yet when it comes to the detail of the agenda plan, but there will be something in that when we've had the agenda setting meeting. Yes. Any other comments or?
So we just need to be careful with that item. What's the outcome? If you find out they're not sustainable, what do we do? As a committee, it's kind of, I wonder if that's more of an informal conversation rather than actually formal scrutiny conversation about the working of the voluntary sector.
Joe?
I guess, you know, given the significant amount of work that the voluntary sector does and the impact it has, I guess if the voluntary sector is not sustainable, it's assessing the impact of that and looking at which groups of people will be most disadvantaged by the loss of that sector. And I don't think you can. I just think it's really important to look at the voluntary sector and the impact of the loss of that voluntary sector will have on people, because it's huge. Yeah, and I think it's a really important issue. So I think perhaps the scrutiny members could look at the impact of it and scrutinise how people will be affected by the risk of losing some of the voluntary sector. And we're aware that the voluntary sector has had particular issues lately in recruiting volunteers. So again, it's not just losing some of the voluntary sector organisations, it's their loss of volunteers again, which may have an impact.
I agree. I think it's important to stay on the work plan as a matter for scrutiny. Councillor Lilly, you had a question.
I was going to say, as a Isle of Wight Council trustee or nominated trustee on Isle of Wight Community Action, I think it would be advisable to actually have an informal briefing initially, because then you can actually have a hard talk about it with key representatives of that voluntary sector through the Isle of Wight Community Action, who actually runs the voluntary sector forum. Because I think it's a bit like the conversation with the independent sector. You know, you'll quite happily talk openly in a internal meeting or a private briefing, but you perhaps find it uncomfortable to talk about it in public. So I think there is a number of issues like, say, you know, volunteers, sustainability, and also a number of organisations, like for instance the Women's Centre, you know, Dash, etc. You know, a number of organisations have gone to the wall or ceased. So I think it's important. But the guru on this is Mike Bulpit, and it's worth actually having a conversation with himself, and also with Joanna regarding the health organisation. So I would just advise to have that conversation. What was the best way to do it?
Thank you, Councillor Lilly. That's something we can definitely take forward. We have a number of informals between now and December, but we might be able to move some things around to accommodate that if the committee feels that would be useful. Yeah. Debbie.
Just to highlight that on the same agenda, the 2nd of December, we're bringing the anti-poverty strategy forward. And of course, that has involved many of our voluntary sector partners. So that may well inform the other agenda item as well.
Thank you.
Can I also suggest that parish and town councils possibly need to be involved in that, because they are more and more funding the voluntary sector. In a lot of cases, they're funding the voluntary sector more than Isle of Wight Council is.
Thank you, Councillor Lee. Any last questions before I move on? Okay. Now we move on to members' questions. Councillor Lilly, would you like to read out your question?
No. It's yes, it is.
Or shall we take it as read?
I think it speaks for itself. I thank for the reply, but I just really wanted to highlight it's a very uncomfortable conversation to talk about death by despair or suicide, i.e. loss. And the comments, and I've had these comments before from Mr. Bryant about, you know, the sensitivities of it, absolutely. But when, as ward councillors, we're on the front line and have to deal with families direct that have lost people, I do feel that there is a powerlessness, that we don't get into discussions at local level, at local solutions and bringing people together. I am actually doing that in Ryde. It's a meeting shortly about this issue. Because we do need to involve all the local stakeholders and voluntary sectors and people. And the families that I'm working with who have lost loved ones over the last literally 6 months, all want to see changes in their local community so it doesn't happen to others for the pain that they're going. And they do feel they have to wait a long time to get through inquests, etc., to actually be able to actively get involved, because they want to actually do that. And I just feel that all the reports nationally are about that this is a, you know, a very grassroots crisis, and we need to have uncomfortable conversations about it. And I do feel, as a local councillor, not a councillor, but an actual political councillor, it is becoming quite tough when you have 3 deaths in your ward. Right? So thank you.
Thank you, Councillor Lee. What I'll do is I will ask Simon to provide an overview of the answer that he gave to your question, and then you can have a follow-up question if you wish, and then we'll have some time for discussion. Okay, thank you.
Yeah, thank you, Chair. So, Councillor, you're absolutely right. It's a really difficult issue and really sensitive issue that we need to address. I think how we manage, as you say, the language is really important. I was really upset to see the way that the report from Manchester called it death to despair. I don't think it's helpful. Actually, what we want to do is support people who are going through a crisis, and sadly, some of them, their lives end for various reasons. You're right. How do we change society so we support people? Everyone feels able to have conversations about suicide, and we have promoted a number of times, and I know Councillor Andre's done it and I've done it, the suicide prevention awareness training. Brilliant 20 minutes for everybody across the community, and we can promote that again, because actually the more people talk about preventing suicide is really important. Deaths from these issues go up and down. The Isle of Wight is sadly really challenged by small numbers. So a little fluctuation looks like it's going up when actually our trends are very much in line with England. What the report did highlight was the fact that in areas where there's higher inequality, poverty, there are going to be more deaths. That's not unusual. You know, we saw that across the country. So where there is areas of, as I say, inequality, we're going to see sadly more deaths, because that's the way society is. It's not a kind of health issue, it's a societal issue. And then how do we support that? We're doing a number of things, as you mentioned, with our military veterans. We've got Amparo now, which is a service for those who are bereaved by suicide. I can't do anything about the coroner's timescale. It does take a long time, and how we support people through that. I've been through that process on the edge myself. It isn't easy. And how do we enable people to understand that? There's some brilliant materials, help us at hand, that we can, as councillors, it's very appropriate for you to give out to support these people. So I think we are doing a lot in this space. We take it really seriously, but let's just be careful how we talk about this. And I think, you know, we aren't having a suicide crisis. We want to deal with each individual one at a population level so we can prevent suicide in our communities.
Thank you, Simon. Michael, did you have a follow-up question?
Be useful to have availability of information. I agree with the suicide training, but not everybody can get onto that. But
Absolutely free, and everyone can get onto it.
What I'm saying is people have to. It's not for me to actually say to others about the priority of this, but actually having available material, and that would actually be very useful, because more and more in I think as a ward councillor, we're having to face these particular things, and often the first point of contact. So actually having availability of material and things, and the lists of people for us to talk to, right, is actually would be very useful. So I pick up on that, but I do think that we have to, in looking at prevention, is also taking out the availability of, or availability of sites, right, or places, or access to the means to do it. And I think I totally take your point in my correspondence with you. Don't want to use words like hotspots or whatever, but we do have to perhaps look at how different areas are managed. And also my question is communities. Recently I've experienced an area which is surrounded by residents and people who all become fearful of a particular place, right? Which their children played in or went in. So it's how do we help or work with communities, because communities have trauma by events, right? As much as that. We learned a lot of that through COVID. And I suppose that's why, my question is, how do we help communities who are in the vicinities of these very sad happenings in actually managing that and changing perhaps areas that, for instance, woodlands. The Woodland Trust's report talks about a recent report by them that it's about they're the ideal for well-being. So, but they can also be a place of sadness. So, how do you take a place of sadness that gets to be known in a community to turn that round to be a place of well-being?
You're absolutely right. So, Chair, so we have Amparo, which is a brilliant service for those who are bereaved by suicide, but that's for anybody. So anyone who's impacted, doesn't matter if you're, the relative or the neighbour. So we can share that with the committee and we can make sure that goes round. I think we also can make sure that the information called Help Us at Hand, which is online, and a physical book, so I can get some of those copies. I'm sure there's some here in my cupboard, but if not, I will get some circulated. We can make that available to councillors. I think it is great that we can promote the training again for all members. I mean, it really makes you think about how to have a conversation. So you're right, there's a number of things. And I think, and taking it away from the Isle of Wight, isn't it really sad that we think Beachy Head, oh, that's where people jump. Actually, Beachy Head is a beautiful place. And you're right, how do we turn things that may have a indication that that's where something may not be quite right into a beautiful place? And how do we turn that around and have conversations? And we can carry on doing that work and work very close to Samaritans around the signs in the right place for preventing suicide.
Thank you, Simon. And so just taking action from that, it would be very useful if you could share some of that information with the committee and perhaps circulate with all councillors. Ian, did you have a question?
And I think if you put the idea in someone's head, they will think about it. But if you don't talk about it, then, we talk about Beachy Head. Everybody knows Beachy Head. Everybody knows Culver Cliff. But if that wasn't publicised, then it wouldn't be common knowledge, would it? And it wouldn't give people the idea, oh, let's go jump off Culver Cliff.
It's, like I said, it's a very sensitive subject, really, on how you manage it. Yeah.
So just a couple of things. If someone is thinking, I could talk about suicide and how you manage it, but actually talking about suicide doesn't increase someone's risk. I always say, and I've had friends come up to me in really bad state, are you safe? You know, actually, if they're not safe, I want to do something about it. And I think you're right. How do we enable people to feel confident to have that conversation? If you see someone at a train station looking really distressed, you think, I don't know what's happening here. How do you kind of break that cycle? And it does work. So I think the training is really helpful. And maybe if I'm a bit bold, Councillor Redrup as chair, I wonder if I could ask you to do the 20-minute training, see what you think of it. Yeah, so if I circulate that and see what I'd really welcome feedback. I found it amazingly helpful when I refreshed myself. So there's a lot to think about. You're right, Councillor Ward, how we do that in a sensitive way for our communities. But let me share that and maybe we can have another conversation afterwards if you do the training and go, this is helpful, but this wasn't.
I think that's a really good point to think about, especially for us to help understand how we can talk about this issue in the best way, because it is very difficult. So I would welcome that training and I will do it. No problem at all. No problem at all. Any other questions or comments from the committee? Councillor Nicholson.
Yeah, just to say, I mean, this is I've got to thank Michael for raising this issue, and of course it is a hugely serious consideration, and it covers so many facets. It is really a multi-service concern with socio-economic circumstances that perhaps drive the tragic figures that we see. And I just want reassurance that this is adequately talked about at different levels. Simon, perhaps Health and Wellbeing Board, but also to note that there are opportunities to engage local councils and particularly those with place plans. And I think Cowes and Northwood are showing an example on this, on how to address the underpinning factors that drive all sorts of medical issues. So I just wanted to make that, and it ties up very well, really, with what we were talking about earlier. And I would really welcome, Simon, you gave a presentation to us about the Joint Strategic Needs Assessment, and that was mind-blowing. And I think to understand what our particular problems are and what the underpinning socio-economic factors are, that we can start addressing them in our local town and parish councils and as ward councillors and through mechanisms like place plans, is really important, because I think none of us have become councillors or become volunteers because we don't want to do anything, but sometimes we don't always know what to do.
It's fine. Thank you, Simon. Thank you, Simon. Thank you very much, Councillor Nicholson. Do we have any actions beyond passing on that information for that agenda point? Councillor, well, not agenda point, the question. Councillor Lilly, are you happy with that? Microphone.
The suicide prevention strategy is a statutory requirement of the Isle of Wight Council. So, like all the statutory responsibilities, I think that they need not necessarily be on your work plan. I want to increase it, but they do need to be looked at annually or to report to this committee. And I think, especially in light of my questions, that perhaps you put on the committee in a year's time or whatever, whenever the strategy need to be reviewed, and I'm sure that date can be given. It's something that I think we need to have that in scrutiny, and it's like other things like the doles and people in bed and breakfast. I've just sent some questions on. There are certain statutory responsibilities, the Isle of Wight Council, that I think is important always for the scrutiny, health and scrutiny, to actually keep an eye on with that. Thank you.
Thank you for raising it, Councillor Lilly, and I'm sure it's something that will be on our minds. I think that is everything. So thank you very much for attending. Yes, and half an hour to spare. Yes, thank you, everyone.